Payne Chevrolet in Springfield. 9 decades, 3 generations, 1 tradition.
I got what I asked for at Payne Chevrolet. That's the honest truth.
Randy, thank you for taking the time to talk to Smoky Barn News. There's a lot of information moving around, some of it good, some of it not so good. And so I'm appreciative that you're taking the opportunity to offer some clarification. So one question that we're getting is, what kind of experience can I expect if I'm coming to NorthCrest Medical Center? Let's say if I don't have the flu, I'm having a heart attack. What's going to happen to me?
Well, the first thing that you're going to experience is that we are on a full building lockdown. There are only 2 entrances to the hospital, one's to the main side and then one's to the ER. If you're experiencing those symptoms, you're going to go through the ER side just like normal. What you will experience when you get there is that you will meet the normal triage experience. You'll have a registrar that's going to be out there with clinical experience. They're going to ask you some questions. However, what you will also notice is that in that triage process of them asking you what's going on and treating the main symptoms, they are also going to interweave some questions about potential exposure to the coronavirus, and so making sure that you also are screened for coronavirus exposure at the same time that they're also working up your main ailment.
So let's say that I think I have the virus. Most people get very nervous. They get any kind of a cold symptom whatsoever, they get nervous. What is the process? What does NorthCrest Medical Center do with that person? How do you test them? How does that work?
Right. Well, the first thing that we encourage you to do is contact your primary care physician. That is a great dialogue to have with them. They're going to be able to give you good guidance. If after a conversation with them, they also think that you may have exposure or be suffering from the coronavirus, they're going to go ahead and send you to what's considered a collection center. We serve as collection centers both here at the hospital through our emergency department, but also on campus at our care center. Then we also have the Pleasant View Quick Care. We have a location with Dr. Mullins in Greenbrier, and Brittany Jepson's office in White House is also a collection center. What you would expect when you go there is another round of screening. They're going to go ahead and question you about what your symptoms are, and since a lot of those are very flu-like in nature, they are going to go ahead and do some tests on you, and those are going to be a flu test and a strep test. Only if those come back negative are they going to go ahead and have a conversation with the Tennessee Department of Health. They're going to call a doctor there, they're going to present your symptoms to them, and they're going to have a conversation about are you high risk or not, and do you need to be tested by the Tennessee Department of Health. If so, they're going to send that test off, and you'll get your results from them in about 2 days. If not, you're going to have a conversation with that provider, because what you're going to hear is that the recovery for the coronavirus is similar to the flu. I'm not saying the coronavirus and the flu are the same thing, but the recovery is, meaning if you're a middle-aged person like myself and you're in relatively good health, you're probably just going to be encouraged to go home, self-quarantine, and after you've been fever-free without the aid of medicine for 72 hours, then you're going to be deemed non-contagious and you can go about your daily life. If you're a high-risk patient, then yes, it's a little bit different. They're going to go ahead and test. You're still going to be self-quarantined while you wait for the results, but again, it's going to go through there. If you're not deemed high risk, yet we still want to go ahead and test you, there are some other alternatives, and by that, we can send your test results off to a commercially available lab. However, the turnaround time on those is a little bit longer, sometimes 5 to 7 days.
Tell me about the hospital itself. How is it running differently? How are you protecting your own staff?
Right. So obviously, healthcare staff is very important to us, but also protecting our patients is very important to us as well. So prior to starting any shift, all of our employees are being screened for any coronavirus-like symptoms. So they're being asked, do they have a fever? Have they taken fever-reducing medications? Do they have a cough or a cold? Or do they just generally not feel well? Answering yes to any of those questions, they won't be clocking in, they won't be working a shift, because we want to protect the patients from any potential exposure that actually comes from the healthcare employee. Outside of that, any visitor that comes in is going to be screened as well with those very, very similar questions. They will not be allowed entry into the hospital if they are exhibiting those symptoms, because that's another way that we're protecting the patients. And then again, every patient coming in, even for an elective procedure, is going to be asked those same coronavirus type questions, so we can make sure that everyone's protected from everyone else.
So otherwise, the hospital is operating normally. There's still surgeries and things like that going on?
Correct. So we still have currently elective procedures going on, such as surgeries, colonoscopies, mammograms, all those wonderful things that go on inside of hospitals. The difference that patients are going to see is that the only way to enter the hospital is through the emergency department or through our main entrance, where they will be greeted by a clinical professional and asked those screening questions. But as of right now, we only have the one Robertson County patient that's tested positive. We're not inundated with corona patients, and therefore we're able to continue our elective procedures. If we begin seeing a large number of coronavirus positive patients, you're probably going to see us reduce our elective procedures coming in, but as of right now, we are business as usual except for the additional screening criteria to come in the door.
Let's say that I had a full-blown emergency.
Mm-hmm.
I'm thinking I'm having a heart attack.
Right.
An accident, a car crash, and I'm in terrible shape, and I need medical help right away.
Right.
Is the coronavirus or any of these safety procedures, are they in any way increasing the danger to me?
Sure. So if you come in for a true medical emergency, meaning heart attack or even a car wreck, what you're going to be greeted by are caregivers who are proactively wearing a mask. That is not necessarily for something for you to be alarmed of, but we have had patients that have come in emergencies over the last few days that subsequently have said, oh, by the way, I was running a fever or have flu-like symptoms. So the way that we're protecting our staff is making sure that in a patient care setting, they are always wearing a mask. That way, even if you're having a heart attack and we find out later that, oh, by the way, I may have had a heart attack, we may have had to take you to the cath lab, but you also were suffering from flu-like symptoms that very well could align with the coronavirus. So what we're doing is business as usual. You'll receive the same expedited care that you need, but the people providing your care will in fact be in a mask for their protection. Outside of that, I just want to make sure of what everyone's expectation within the general public should be is, of course, they're very nervous about this situation. But if you do feel like you're experiencing symptoms that might be the same as what you're hearing about coronavirus, the first thing we want to do is make sure that you contact your healthcare provider. Primary care physicians, they're the best resource that you should be going to. But then, if you do talk with them, more than likely they're going to say that you probably ought to go to a center that is able to collect a sample. The collection centers for us in this area are the NorthCrest Care Center that's here on campus. Our emergency room is able to collect, as well as we have some quick care locations in Pleasant View, Greenbrier, and White House. So what you should expect when you go there, though, is going to be another set of screening criteria. The first thing they're going to do is ask you, of course, for your signs and symptoms. Most people are presenting with what are flu-like symptoms, and so the first thing we need to do is eliminate that it might just be the flu. So you are going to receive a flu and a strep test. If those are negative, then we are going to go ahead and contact the Tennessee Department of Health. They have a provider that's on the other end of the line. Our provider will call them, and they're going to go through the presentation of you, your symptoms, and really what other underlying medical conditions you may have. If the Tennessee Department of Health feels that you are considered a high-risk patient, then they're going to clear you for testing. We're going to go ahead and take the sample, and we will send it to them for testing. We do see consistently that we get results from the Tennessee Department of Health in about 2 days. Now, that's actually a very small subset of people who are deemed high risk. The majority of people are going to look a little bit like me in terms of being middle-aged, healthy, no other underlying conditions. More than likely, if the Tennessee Department of Health says that we're not going to test you, then we're going to have a conversation with you, and that is, do we feel that you need to be tested, or do you understand that the treatment for a potential coronavirus is actually going to be very, very similar to what we tell you for the flu, which is go home, self-quarantine, and as soon as you've been fever-free without the use of medications for 72 hours, you are deemed to be non-contagious and you can go about your daily life. Now, we would encourage you that if you choose to go home and self-quarantine, that means go home and self-quarantine. It does not mean go to Walgreens or Walmart on your way home to pick up a bunch of soup. You are considered contagious. You need to go home and someone else needs to run those errands for you. If we all come together and decide that, you know what, even though you weren't deemed high risk through the TDH, we can at that point elect to go ahead and test you ourselves. We will swab you, and we can send that off to a commercial lab, and it will take a little bit longer to get those results, but you will have that peace of mind of potentially having that diagnosis. But that is really what it is. We urge calm the process. You might expect that there's lights and sirens and people running around. It's really not what it is. We understand how to handle this. We hope that you all understand that the panic isn't necessarily justified, and that we can take care of you at those locations and make sure that you get the appropriate screening and the appropriate care.
I like to go ha, 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 ha. I like to go he, 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 he. We have a lot of fun, my mouth and me.
I like to go. I like to go. I like to go.
Big City Dining in Springfield. Depot Bar and Grill.